Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati. So, Dr. Bonati, why does the spine industry continue to use spinal fusions?
I am very confused constantly the way that we are treating patients with spine problems. Those treatments are practically failing. And every time that we review literature, the combination of neck problem and back problem affect approximately 1/3 of the world population. So you can see how enormous is the amount of people that are suffering with this type of a problem. And what is amazing to me is that we constantly talk about treatments. At the Institute, we treat people and we get people better almost immediately. Or the things that we develop at the Institute are so unique that they are not in the market. And then makes me feel that if we do something so fantastic, why is not the world moving in that direction? And I see constantly more and more input towards instrumentation that is so destructive, so painful, and requires so much time to recover the patient. And the amount of patients that they recover is only 40%. We recover 90% of the patients in a week. So the problem that I see here is what we do so well that is not being done in other places.
You're up against the device companies who are creating these products, and they know that they're ineffective. It's not about treating a patient's pain and really giving them a resolution to the problem.
You're seeing major universities with quote-unquote teachers and professors. They are in a field of experimentation because they allowed experimentation at the universities. Why these universities are so lost? Why do you see that the market of instrumentation is so powerful that can overtake the intellectual capacity of doctors to improve the conditions of the patients without this suffering?
If you remember correctly, we covered this on previous episodes of American Medicine Today, but it's the fake research and trials about fusions that were put out into public forum. And what they did is they were incomplete and put it out there where everyone's believing these manufactured trials.
We are the people that need to avoid the fraud. And if we do that, then the universities are responsible to do that. Okay, I fight constantly against the devices because I think they are unnecessary. I think they are dangerous. And I see that instead to try to reduce the damage and the pain of a patient and the expenses and the fact that they suffer these people for months, I feel now they develop another device that only can be treated to fuse the spine going through the abdomen. So it will require a general surgeon. The industry is to devise something that can help the patient, not something that it can harm the patient. And we see that the fusions is very well known that they harm the patients all the time. I take instrumentation very frequent in the practice because I know there was an unnecessary surgery, not because the surgeon is doing an unnecessary surgery. It's because they taught this surgeon that that is the only way that this patient can help or can be helped.
So I don't understand, isn't the direct approach the better one? Slitting somebody open from the front and having to remove organs and do something that can be very dangerous for the patient, isn't it better to go through the back?
If I am successful in something, I want to repeat that success and improve on that success. If I do something and I fail, I don't want to touch that again, because I know I did the best and didn't work not because of my skills, because what we are doing is incorrect. So common sense is not being applied here. You do fusions and you know the disaster with the fusions.
Well, 1-level fusions fail 65% of the time, and 2 to 3-level fusions fail 85% of the time.
I don't understand why that technique continue being bring to educate the new surgeons. That technique should be eliminated because the industry is corrupting the teachers, and the teachers are instructing wrong the students. So we start to see a path of behavior that is being seen in this country now in everything.
I think that's because the industry is focusing more on procedural technique versus true patient pain resolution, instead of it being more patient-centric and about results and how that is helping them achieve pain relief. Make sure you stay tuned. We'll have more after the break. You are watching American Medicine Today.